main things here in Nevada is public lands and the use of it. And I know you're one of the only candidates who's really started on the forefront of public lands issues.
Yeah, I think I might be the only one that laid out a detailed plan to change the relationship with the federal government and local communities and states. There needs to be more deference given to states and more deference given to citizens. I mean, this president has expanded the use of monuments to restrict access to public lands. It appears across the West, particularly where the federal ownership is high, there's very little deference in terms of species management or land management in general. And those conflicts, I think, can be resolved with more respect for creating partnerships rather than having Washington dictate everything. They're not really good at it.
And as far as is one of your solutions is moving the Interior Department out to the west?
Yes, that is not just a symbol. I think that would be a very positive step. We asked a lot of people what they thought about that. I'm not into hokey things. I'm pretty substantive about ideas, and the general response was the secretary is always from the west, but the people that do make the decisions, the bureaucrats, they're located in Maryland, Virginia, D.C., and so shifting the department altogether, I think, would allow for the department to be the employees to be more sensitized to the unique nature of the West. It's dramatically different than the East Coast. So whether it's access for economic purposes of the lands, or species management, or timber management, the focus on, rather than purchasing more conservation lands, to start focusing on management of the lands that the federal government already owns. We're celebrating the 100th anniversary of the National Park Service, which was an extraordinary achievement for our country, and but there's a $10 billion backlog. You can imagine if you could create a culture of conservation and recreation for the next generation. I think it's worth shifting, and so shifting the department goes beyond being a symbol.
Okay, and one of the solutions
Elko High School Marching Band.
Yes, it is. One of the solutions that some of our local politicians here, our county commission, and even our representative Mark Amodei has brought up is actually getting full statehood, as far as giving some of the public lands to the states to control. Where do you stand on that?
Well, Mark is a supporter of mine and one of the primary advisors when we created this Western lands policy. So I would take his advice seriously, and we did. And I think it's possible to look at pilot programs to transfer lands. But the bigger issue is, how do you create a more respect and more of a partnership kind of mentality? This is the problem with Washington across the board, is this top-down driven nature that they're smarter. They're not. They're dumber when you look at the results. I think people care more about lands where they live. They're more respectful of the lands. They're good stewards of the environment. And so shifting this is important. And I think there certainly could be look at some pilot programs to transfer land ownership, but that doesn't solve the bigger issue, which is how do you provide access? How do you balance the economic interest with the environmental questions? How do you preserve the heritage of the West so that you can create a culture of recreation, which means I think focusing on our national parks to be a huge economic driver if we created a whole new generation of people that love the outdoors. How do you allow hunting and fishing and mining and timbering and all the things that go on? You don't want to restrict this, and that's what Washington seems to be more, their impulse is to restrict access.
Okay. Now, one of the other issues that I saw is you've called Obamacare a monstrosity, and you'd like to go back to a more private-based system. And in the rurals, we have a really hard time getting doctors and getting them to come here, or even to accept Medicare. Do you have any solution? Medicaid or Medicare, actually, in this town.
Wow. Well, Medicare normally reimburses at a much higher rate than Medicaid, but if you had a system that gave $3,100 tax credits to people that didn't have insurance through their company, and you shifted back to Nevada the exchanges without the employer mandate, employee mandate, and all the mandated benefits, you could create lower cost insurance where you could reimburse providers at a higher rate, where the focus would be on using this tax credit. People could actually purchase insurance that would be focused on catastrophic coverage. Well, as a society, I think the smart thing to do is to make sure people have peace of mind that an adverse health event, a stroke, a calamity of some kind, doesn't just change your whole life forever. And that's what catastrophic coverage could do. But I think individuals need to be much more engaged in their healthcare decisions, and there'd be more information. We ultimately need to get to telemedicine, and we need to extend the reach of doctors through nurse practitioners and other means. If this, the states have a responsibility, I think, to deal with their unique situations. Some states have advanced, the extension of healthcare providing via the internet and through physician assistants and nurse practitioners and nurses. Others haven't. I don't know what the Nevada situation is, but that's another way to look at it, to deal with this, is to primary care can be delivered in different ways than it was 25 years ago.
Okay.
This crazy thing called the internet.
And also, we're a mining town.
Yeah.
And so we actually get a lot of people that come here from Africa and Australia and Canada. And I know in your immigration policy, you're talking about more moving it toward, let's bring people in based on their skills.
Yeah. So who are the people coming in?
A lot of times they're miners, geologists, engineers. Oh yeah.
Oh wow, interesting.
Yeah.
Yeah. Look, our immigration system is not working. It's not working. It's not, the legal part of it is obsolete. The illegal part is just upsetting. So we need to control the border. We need to have an e-verify system so that employers know when they're hiring someone, they're here legally. We need to narrow the number of people coming by family petition and expand the number of people for economic purposes. And if you control the border and you're serious about it, you could transform our legal system into an economic driver. We have a skills gap in this country that ultimately needs to be filled by Americans with better education, better training. But there are a lot of jobs that could be filled by immigrants that could be a catalyst for other economic activity for all of us. And I think that's what we need to focus on, is to make sure that we do this in a balanced way, protecting the economic interests of citizens. But immigration can be a tool for sustained growth. Right now it isn't.
The other issue that is actually near and dear to our hearts here in Elko are veterans and veteran care.
Yeah.
And
you guys have a clinic here?
No, we don't. We have telemedicine, but it's still very difficult.
Furthest clinic away is how far?
And one of the main issues.
Is it Salt Lake? We're for the hospital. What's
Salt Lake.
How far is that?
3.5 hour drive. So, but one of the main issues is mental health care. And we've had several, we even had an officer who had to shoot and kill a veteran who was suffering from PTSD. And he didn't get the necessary mental health care. So as far as mental health care and increasing that.
Yeah, look, not just for veterans, although we need stem to stern reform of the Veterans Administration. I was with someone who's really focused on veterans issues, and he said, I asked him what we should do, and he said we should create centers of excellence for the unique war-related diseases, long-term disability challenges for people that we've saved lives now. When a soldier is wounded, he's not dying to the same extent because they forward lean all of this really sophisticated healthcare to save lives, but then you have permanent disabilities, long-term challenges. That's a center of excellence opportunity. Post-traumatic stress is another one. As a society, we're not dealing with mental health challenges well. There are big gaps, and I hope here in Elko you don't have the affliction of heroin.
Oh, we do. Heroin and meth.
Yeah, these are big challenges in our country now, and addiction, dually diagnosed with mental health challenges, is one of the great challenges of our time. So The federal government needs to play a constructive role in this. Certainly as it relates to veterans, there should be greater access to mental health provision. And frankly, veterans should be given choice cards. So if you don't want to travel 3.5 hours to go to Salt Lake City, and it's a issue that can be dealt with in the community, a veteran should be empowered to make that choice. It's really hard. On a small scale that exists, but it's very minor compared to what it could be.
Well, that's it for me.
Thank you. You won the award. Congratulations.